Now, our final speaker brings together a critical theme of our entire meeting this morning. Lyndon Carter, who is from the great city of Houston, Texas, the Houston factor. It's probably the greatest city in the United States when I talk to anybody from Houston, and I think they have good reason for that. I hope Mayor Bloomberg isn't here today, but anyway. Lyndon has founded an organization called Making Ends Meet. It's a 501c3 nonprofit which provides education for newly diagnosed end-stage renal disease patients about available resources, explains the financial impact of their disease, helps them adjust to the issues that they have. He's working with the American Kidney Fund, American Association of Kidney Patients. But if we want to talk about a real expert, at age 25, Lyndon, after being in a car crash with a drunk driver, received 2 successful kidney transplants because of injury. He spent 10 years on dialysis. So Lyndon speaks from inside the system. He knows what it's all about. And I think he is an incredible example of a community-based person who has taken his experience and transformed that into something that reaches people who are not otherwise being reached. And I think if we're thinking about the workforce of the future, Lyndon, that's a critical component, and we're anxious to hear your advice as to how we bring that in and get your help to build a team that includes community people, just as Wanda was discussing. So Lyndon, you're on.
Good morning. You know, I'm honored to share the stage with my fellow presenters and distinguished renal professionals that have been assembled for this symposium. I've been increased by all the information that has been, provided up until now. Please allow me to make a few acknowledgments before I begin. I want to introduce you to my wife, Catherine Carter. We've been married 13 years now, and the significance of that is that she's a volunteer of our organization, and she's also, we met while I was on dialysis, and she seen me through several difficult time periods in my life, as well as 2 successful transplants. And so I'm really grateful to have her by my side, so I felt it was important to introduce her. I also have 2 of my best friends here, Annette Johnson and Mr. James Johnson. They once lived in the Houston area, and they now live in New York. Yeah. And so Annette been with me through thick and thin. I mean, she was there originally when I first started this program. This program has evolved so much from the beginning when I first started it. I mean, it doesn't even look the same. I don't think it does from the time we started this program. And so I'm very grateful to her. She's our marketing consultant. She's our PR marketing company that represents our organization. She handles all our press releases. She does many facets of what I do every day. I can only stand here because of so many different people who does things behind the scenes. It is hard work running a nonprofit, especially when you're the only one who believes in it. And so it's really great to have her on my team. And last but not least, I want to thank Marcia Copeland, from Dreyfus Foundation, because when I first come to her project for Solutions for Better Living, I didn't even know what I wanted to say. I knew I had something to say, but did not know what I wanted to say. And she really helped me develop that tremendously. Her and Valerie Jackson, the project manager. Valerie is the backbone of Solutions for Better Living. Because Valerie, she treats every project like that project is her own, and she doesn't distinguish one from the other. You can call her at nighttime. She's sending you emails at 1 in the morning. If you need anything from her, a letter of recommendation of anything, Valerie gets it to you. And so she's one of the hardest working people that I do know. And so saying that, and just to go into my project a little bit about what I do, a little bit about myself. And that's probably one of the most difficult things for me, talking about me, because I do care about the project, and I never wanted to take on my personality when I first started. Many times that whenever we do things in the public, I do not mind sharing that stage with anybody. I mean, because I do not want to be my project, because it's really from things that I've seen and done while I was on dialysis that this program was really formed from. Like I said, I am the executive director before Dialysis Hookup, a nonprofit organization for kidney patients in the Houston area. You know, I spent most of my adult life on dialysis and dealing with kidney disease. I was in a car accident back in 1989 with someone driving under the influence of alcohol. That accident elevated my blood pressure to levels that could not be controlled. Therefore, forcing me to make a decision to have my kidneys removed to minimize the effects of having a stroke. So you can say that I pretty much had to induce my own self on dialysis. And that was a very tough decision at that time. The nephrologist who did my nephrectomy, he would not, do it unless I was totally on board with it. He did not care what the nephrologist had to say about it or what my parents had to say at that time. It was totally my decision. And he said, we'll keep on trying to reduce the blood pressure if we have to, but he said that you're taking the risk more and more of having stroke, because my blood pressure was running at that time 200 over 170 on a constant level. And so at that time, he said, you're very young, and you can also, we can fight another fight that day and, and get a transplant and you can move on. And that's the decision I made. So I had 2 perfectly working good kidneys at that time. And both of my kidneys was deeply damaged because of the high blood pressure. I had constant stays in the hospitals due to noncompliance and ignorance about my condition. There was no support groups or mentors when I began my dialysis therapies. I made mistake after mistake that could have been adverse effect if I did not change. I had to make a conscious decision to live, a decision that anyone who is impacted by chronic illness must make. Years after I became stable, I had a desire to work, and I went looking for work, and therefore, with my dialysis schedule, that was almost impossible. So therefore, I became a licensed insurance broker, and that allowed me to go into entrepreneurship, and then also allowed me to control my schedule. And so therefore, that's how I supported my family for a number of years. Things that I learned, while on dialysis. I was confused and frightened when I began my dialysis therapy. The only information that I received from patients was patients who self-diagnosed themselves. And unfortunately, that still goes on today. I mean, the first thing you do when you go into a unit, you got all these health professionals that are there for you. Most information is disseminated by patients, because most of the time people give them so much credibility because they've been doing dialysis for so long, they feel like the health professional has no idea what it's like to sit on that machine. And that could be true in some points. And so therefore, you kind of gravitate toward that information. If you want to know anything what's going on in the community or in the things that can benefit patients, you learn from another patient. Because whenever a patient was about to, lose their home or anything like that, they knew where the city programs were. They knew where everywhere you can go and find those resources. Or whenever there was a lack of need for, prescription drug coverage, or who's provided for free or complimentary, those patients knew where it was. And I think that's one area that the professionals are missing on that level right there. They're missing that deeply, because patients are resourceful, and they're not looking forward to more or less better, for the better of the unit, to better themselves individually. And so much of the information was negative when I began, my therapy. Some patients that attended my meetings today tell me that things haven't changed much. It's a really negative place in there sometimes. And if that's the first person that a patient sees when they first begin their dialysis, you're already on a downturn. Because now anytime somebody really comes to help them realistically and who really wants to help them, they can't, because that patient already bought into that this is how it's going to be. My first 3 years were my worst. I was in denial. I felt that I could not see, I would not even see the age of 40, listening to some patients. And at that time I felt that way. I started dialysis back in '89. Therapy has changed so much, from back then. I mean, now they use kilos. I started dialysis when they used actual pounds. And the machines were not as advanced as they are right now. I mean, back then, it was almost an estimate how much fluid they can take off of you. Now they can almost pinpoint to the exact amount, including what you're drinking at that moment, when you're in the dialysis unit. So patients, they come to me all the time and say, things are so terrible. I say, no, you don't know terrible. You don't know terrible because sometimes you don't know when your blood pressure is going to drop while you're on dialysis. And they have to lay your leg back and your feet up and, and run the blood back to your head. Or to go to a therapy where they took off 8 pounds of fluid to have to put it back on to get your blood pressure back up. And then you have to take another treatment the next day. So they don't understand that things are a lot better than they used to be. So I came to the conclusion that I personally witnessed patients dying from end-stage renal disease. Most of the units are active and social until we learn someone has passed away. You cannot hear a pin drop in a unit when you know one of your fellow patients have died, because now reality sets in when your turn is next. And no one says it, but you can always look in each other's faces and it's just no one's talking about it. And so, so no one said it, but so we all knew that, eventually, dialyzing was not the answer altogether. It kept you alive, but it was not a cure unless you go through transplantation. I was ignorant to many of the rights and privileges for end-stage renal disease patients. I did not know the role of the physician toward the patient, or the rights to change doctors or a unit, or the rights for dialysis centers' rights toward its customer. You had rights, and sometimes when I left the unit, when I went on dialysis years ago, you'd leave the hospital, they give you a nephrologist, and they send you to a unit, and you thought that's where you just had to stay. No one never changed. And no one explained that you can pick your own nephrologist, or you can pick your own unit where you receive your therapy. It was just how it was. That's how much information that was really given when you went into that situation. Insurance. No one came around and explained how Medicare works for a person who is suffering from kidney disease. The community programs that, no one really talks about the programs that the community offer for those people who are on dialysis. No one spoke about, the employer's responsibility for those who are suffering from chronic illnesses. Many times, once you go to your employer and indicate that you are suffering from kidney disease, they're automatically trying to run you out the system. They really are, because now you're affecting their insurance pool. And so therefore, they'll try to make it very uncomfortable for you to be in that position. But then now, through some of the new laws, that's not the case anymore. And to this very day, so many patients are still ill-informed. No one tells them about their rights. So what we try to do with my organization is, I really want to talk to the pre-existing, the pre-dialysis patients, because we try to make sure they stay on their job, because it's so important, because whenever you have a private care insurance company, that goes in position 1, and Medicare goes in position 2. The problem is that when you lose that primary care, Medicare automatically goes to number 1, and that patient has a responsibility for the other 20%. No one explains that to them when you first go into a unit. Right now, every patient can get a Medicare Part A and B. A Part A supplement for the first 6 months of dialysis. No questions asked. You cannot be refused. No one talks about that. When you do finally hear about it, it's too late, and now the insurance companies will deny you. So now, every time you go to the hospital, that 20% that needs to be covered, that's your portion. No one explains the benefit periods in the hospital. You get 5 benefit periods. No one knows how those benefit periods work. So many things that happen very quickly when you go first, go on dialysis that no one really talks to you about. And I think that's a very crucial point that has to be addressed. Because not only that, even the physicians that are getting paid, we heard today about the cost reductions for physicians being paid. The problem is if you get that 20% back, because most of the time that 20% is lost, it's never regained. Because most patients live up under the poverty line and they can't afford to pay it. So that's an opportunity that's being missed by everyone. So, I feel that professionals, community need to do a better job of working with caregivers. Patients do not voluntarily share information about their illness. At least I didn't, because the moment I left dialysis, I wanted to forget about it. I did not want to talk about it anymore. And I'm not about to go home and sit with my wife and she say, "How are you doing?" I mean, it was no conversation for me, because especially if you had a bad day at treatment, you didn't want to talk about it anymore. So I think there needs to be different, programs set up for just caregivers and family members, because of the fact that many patients do not give it. Most times, many people who live in the same household with a person dealing with dialysis don't know what that patient goes through, or all the different types of mental things that goes along with that, all the kind of, rejections that they feel, especially for men, because men relate everything to money. We relate everything by being a breadwinner, by being a man. It has something to do with profitability. It's just being a man. And then when you're on dialysis, it was hard for me to watch my wife go to work every day while I stay at home. I would have did anything. At one time, I had 3 jobs while she had 1, and all of them was part-time jobs, working this day, working that day, just to feel it wasn't anything to do with the money. It had nothing to do with the money. Just having my self-esteem. So, I thought family members have no idea what to expect from a patient dealing with chronic disease and how it affects the family socially and financially. I used to always, my wife used to always want to plan spontaneous vacations and things like that. With patients, that's impossible, because you have to always consider your treatment. And she never understood that sometimes, then patients are very self-conscious. Many of them do not like to show their grafts or their, fistulas, where they have all the scars, from the surgeries. So we're very self-conscious about that. And many people, they take that for granted. They feel like you're just trying to be antisocial or you have different norms, but that's not the case. No one wants to get in line at a restaurant and have to explain what those scars mean. That goes again to talking about your illness. And so no one wants to talk about that again. So therefore, you'll find most dialysis patients, they cover up a lot. They wear too many clothes, and sometimes even when it's hot. But just to keep them having that conversation, though. That's how much they want to talk less about it. Then opportunities addressed from patients from some past workshops that I've had. Patients are concerned with employment opportunities for patients, for someone who are dealing with pre-existing illness. Insurance opportunities, life and supplemental. Patients are concerned with help from prescription co-pays and the unpaid 20% portion for Medicare. Scholarship programs to higher education. Programs for family members or caregivers. Employment is the biggest problem facing people on dialysis. I have yet to meet a person who is happy to receive disability payments due to chronic kidney disease. You must remember that everyone on dialysis at one time or another was once working. And so that's what, I think that most people are very encouraged about. Programs that Before Dialysis Hookup provide. We provide a dialysis support group, a place where patients can come and feel normal and not be identified as a dialysis patient. We have a kidney disease community outreach. We provide health fairs and we go into faith-based institutions to provide information. Promotions of organ donations, especially for the Afro-American community. Right now in this country, we have a collaborative partner called Life Gift in the Houston area. And Life Gift indicated to me that Afro-Americans donate about 12% of the time for organ donations, but receive a much greater number than that. So we need to bring awareness to that as well. Kidney disease is a growing, then we also have a scholarship program for higher education for dialysis patients. We need to transform how patients think and get them back into the workforce as much as possible, because it's one of the problems that's the insolvency of Medicare. So the more patients we get back to work who can work, and it's not going to be for everybody, but many patients on dialysis can do some type of work. We need to have a better education system for employers who hire dialysis patients. I mean, most patients can do any kind of job that anyone else can do. It's just really a scheduling problem. And so if we just really go into that situation and revamp that situation to where we increase their knowledge about how to work with somebody who's working with on dialysis, I think we'll get many of them back into work. Kidney disease is growing rapidly, and we need to do everything possible to reduce this population without forgetting about the ones who have been affected by this disease, while at the same time helping those who have been transplanted to become marketable back into the workplace through higher education or entrepreneurship. I sometimes feel that that's the reason why so many do not seek transplants, because they will eventually have to be integrated back into the workplace. We need to prepare patients who have been transplanted, to go back into the workplace and to earn a living. Because you have to remember that many patients, once you do get a transplant, you have 36 months to be, according to Medicare, Social Security, to be integrated back into the system. So therefore, if you've been on dialysis 5 to 6 years or more, you're behind the curve. You're behind the learning curve to go back into work. And so that's a problem that needs to be addressed, because many of them, like I said, they don't see a hope in competing in a regular marketplace with those who have had a 5-year jump on, in the marketplace. My final slide is how do we provide this information to the public? Before Dialysis Hookup provides this information complimentary to all who wishes to attend, 2 to 3 times a month in the Houston area. Our workshops, community meetings are held at various locations, city health centers, dialysis centers, and private health organizations, to make it more accessible for the patients to attend. One reason I partner with the health centers is because everything happens in the health center. I mean, there are food programs, there are any kind of social programs there. So therefore, I want to have a meeting where the people are already familiar with and know where to go. And I think in most of these places, they will allow you to have them, complimentary or for a nominal fee. So I think those are the best opportunities we can have right there, is going back into the community centers. To make it more, our services are provided through volunteers, like Annette and my wife and many others. We are aggressively pursuing funding sources to help us provide valuable information to the population who desperately needs it. Finally, a quote from Miles Monroe states, crisis forces development. That's a quote that he often uses. He said, crisis forces development. And it states that when things reach a crisis point, there's only one way out. It has to come through some kind of shift or change. Before Dialysis Hookup exists to help make that shift. I thank you for your time this morning.
I think that's an incredible story of what can be done, and I can only think that around New York State, which is another great state like Texas, we ought to have programs like that around the state. But I think, Lyndon, you made an extremely important point, which is people are not defined by kidney disease. They're people. They need to eat. They need to support their families. And I think as we look at the workforce and how we move forward to take better care of people, And that's really what it is. We use the term patients all the time, but all patients are people, and all people are ultimately patients. I don't know of anyone who's escaped this life without being a patient. So I think when we change our attitude, and we talk about health reform, we talk about evolution of this and that, but really we have an opportunity now that's for a revolution in how we do things. And I think we can make our care not only of much better quality, but more cost effective, which again you were saying.